Welcome to Medica Nova Wellness Studio. I'm Dr. AngelikaMariaKoch with the educational videos about optimal health and the most innovative and holistic approach to your well-being. Before we start with another video, I would like to send you all out there my love and healing. Keep boosting your immune system. Stay strong within as without. And during these challenging times, my heart is with you. As we are still focusing around the head area, today let's take a look at your breathing and how you can heal your sleep apnea. At Medica Nova, some of my patients who contact me, they already use a CPAP machine or breathing masks to alleviate the difficulty breathing freely during the night. So in this video, I share with you what I share with my patients too. So enjoy. To stay updated with my ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and family, and have a look at my website, medicanova.net, at the online academy, where you will find comprehensive certified home study online courses in homeopathy, in mental health, and health and wellness coaching, quantum healing, and so much more. And if you're interested in a personal health consultation, either for yourself or your children, contact me at health@medicanova.net. I'm happy to help. So what's sleep apnea? Well, sleep apnea is a disorder that causes poor sleep quality due to these uncontrollable pauses in breathing, or taking shallow breath during the sleep and suddenly waking up or feeling startled. Now, during the night, someone with sleep apnea might even repeatedly stop breathing up to 30 times every hour. That's a lot, and often for very brief moments. And the scary part is they don't even realize it, and even in the morning wake up and say, "Oh, I had a good night's sleep." But because these breaks in normal breathing cause less oxygen supply, to make its way to the brain as well as throughout the body, people with sleep apnea are triggered, therefore, to wake up or feel startled or even gasp for air because they can't reopen the airways. Now, it's sort of a start and stop breathing process, is of course associated with the symptomatology sleep apnea, but it also is associated with other symptoms. For example, people really snore loud, not just a little bit, but loud, or they have these choking noises. And, because they can't sleep during the day, they feel fatigued and have lack of concentration, or even experience anxiety going back to sleep because this might happen again. So it really affects the quality of life. Now, statistically, there are about 50 million to 70 million of Americans who experience some kind of sleep or wakeful disorders in general, and about, they say, 12 to 18 million of Americans definitely suffer from sleep apnea. Men are twice more affected than women, and it's usually more in adults above the age of 45 years old. Now, I would say men and women are both affected if they are obese or consume a lot of alcohol or smoke. I think then there isn't much difference here. But according to the National Institute of Health, sleep apnea is the leading cause of excessive daytime drowsiness in adults, so that's an interesting factor. Now, long-term complications of lack of sleep and sleep apnea can, of course, include increased risk for heart disease. We have stroke, tendency, of course, then to obesity, and then depression comes in. Diabetes plays a big part here as well, next to memory problems and just total lack of concentration. Also, your immune system goes down, right? So you're prone to colds and coughs and, surrounding viruses. Many people with sleep apnea, of course, use a breathing mask to help control the symptoms, but unfortunately, it doesn't really heal the underlying problem, which is really an inflammation of the throat muscles. Right? That's what we want to look at, and I hope this video gives you some natural solutions how to deal with that. So what are these symptoms? Well, I talked about loud snoring, and that's really loud, right? You don't want to sleep next to somebody who suffers from sleep apnea. It's really loud. And the snoring is also punctuated with silence in between. Feeling like you're always tired and drowsy, even after getting a full night's sleep. Waking up suddenly or abruptly, feeling startled by the loss of breath. They call it episodes of breathing cessation. Also experience pausing in breathing or flow. Pauses in breath happen more than 4 to 5 times per hour, and in severe cases can occur almost every minute during the night. Also, if other people witness, right, that you have this cessation of breathings, right, that's important. You start, you stop. There's no general rhythm going on. The shortness of breath when waking up, and also night sweating because you're exhausted. There may be frequent urination. People who use CPAP machines or breathing masks, often they wake up with a dry mouth or even a sore throat, or bad breath can be involved in that. Needless to say, headaches are involved with that. Mood-wise, God, if you don't have a good night's sleep, you wake up irritable, right? Leave me alone. I need have to catch up with some hours. But as I said, most people don't even know that's happening during the night. Because of sleep apnea, because of this interrupted sleep and startling and waking up, maybe other sleep disorders can develop, like insomnia, like difficulty falling asleep or staying asleep. And then during the day, the attention or the lack of attention, lack of concentration, poor memory during the daytime, all that can be quite pronounced. And I mentioned anybody who suffers from autoimmune diseases, thyroid disorders even, and just general low immune function. It's important here to have a look at. Now, what are the causes? I would say weight, right? Obesity, huge deal here. Older age, of course, I talked about anybody above 45, being a male maybe, or having narrowed air pathways in general, right? So if you have, it could be inherited, but if you have a chronic congestion, sinus congestion on a regular basis, enlarged tonsils or swollen adenoids, you suffer from rhinitis all the time, that may be part of that as well. Of course, it could be a family history of sleep disorders, but most of the time there are other causes or direct causes behind it. People who use sleep aids or tranquilizers on a regular basis, over medication, of course. Also, a family history of heart diseases, I mentioned, stroke, autoimmune disorders in general, even definitely thyroid. And I would say the main part is acid reflux also. Is a big part here. If you recently had constant chronic coughs, particularly during the night, that could add to it. And I mentioned sort of sinus ingestion, allergies. Both smoking and alcohol, can also contribute to cellular inflammation and this fluid retention in the airways, which then disturb your normal sleep. Smokers actually are 3 times more likely to have obstructive sleep apnea than people who never smoked. And that brings me to the next point, that we have 3 different kinds of sleep apnea. And they're triggered by different things, but can cause similar symptoms, and the complications are the same as well. And symptoms of the 2 most common types, it's called obstructive and central sleep apnea, are very similar, and often one cannot really differentiate what's what. And I want to explain it to you. The first one is called obstructive sleep apnea, and that's the most common one. And it develops due to this abnormal relaxation of muscles in the throat. Remember, in the beginning of this video I said it's not necessarily something that you can't keep your ear passages open, but there's something wrong with this throat muscles. And that also is part of that, it causes this loud snoring. So normally the throat muscles support breathing by relaxing, but also tensing parts of your mouth and the esophagus that allow for air to pass through. Now with sleep apnea, you have this abnormal relaxation of the throat muscles, causing the shortness of breath during the sleep, which then can cut off oxygen supply and trigger your brain to keep waking you up in order, to gasp for air, for example. So it's really a sort of misinformation going around your throat muscles. The central sleep apnea, the second one, is less common. And here although they are related, here the focus is really coming from the brain, because the brain stops sending normal signals to your muscles that help control the breathing. So unknowingly, people with central sleep apnea make no effort to breathe for short periods of time because their throat muscles don't know what to do. They didn't get the stimulus, the nerve impulse to contract. So it's really a nervous system situation here, right? And we have to really differentiate here, and that's why the emotional part is here so important. Really look at it. Are people anxious? What stress is in their lives, in order to, that the nervous system is fried. That's really what it boils down to. So it leaves them short of breath because the brain doesn't really coordinate with the throat muscles. And then we have the complex sleep apnea syndrome, which is a combination of both the obstructive sleep apnea and the central sleep apnea, and they go together. But fortunately, sleep apnea can be treated and prevented by making certain lifestyle changes, dietary changes, losing weight, bringing in more exercise. So I want to look at some natural treatments in general. Well, the first one I would say on the top of the list should be losing weight or maintain a healthy weight. The reason is because when you gain weight, the inside of your neck really expands, which affects then your throat muscles and breathing capabilities. So the more overweight you are, the more likely you are to have sleep disturbances, since the fat deposits around your upper airway can obstruct normal breathing. They say in men, the sort of neck measurement or the collar size, if it's sort of over 17 inches or 43 centimeters, and in women over 15 inches or 38 centimeters, then we have a problem. Then you're more of a higher risk to experience sleep apnea. If you're overweight or obese, the reasonable goal should be to lose 10% of your body weight. And that gives you just a little bit of a breathing space, literally. So you keep your airways open, they don't collapse during the sleep, and also reduce the inflammatory aspect around the throat muscles. Now, when we go into diet, I looked around different practitioners, what they suggest online, and Dr. Axe, for example, said bring in a high fiber diet, right? Bring in more, of course, fresh veggies, fruit, nuts, seeds, sprouted beans, legumes, ancient grains, about 25 to 30 grams per day. I would start with high potency oils, coconut oils, because it has this fat burning effect. But any good oils like organic, cold pressed virgin olive oil, avocado oil, all these are anti-inflammatory agents, which is really nice for your throat as well. Now, if you have problems losing weight, first of all, maybe you want to contact Medica Nova, the wellness coaching program. We have a 3-month coaching program which focuses on these issues. But you want to even maybe bring in some adaptogen herbs. Rhodiola is a very good one. Maca if you have hormonal problems. Ginger maybe helps a little bit as well. Needless to say, you have to move your body. Exercise is huge here. So daily 30 minutes of brisk walk would be really nice, or this burst training exercises. You want to bring in some yoga. You want to move your circulation within your body really well. Now, you maybe for your birthday gift yourself with a humidifier, an electric humidifier. It really helps. Want to bring in some essential oils, and this spreads through your whole room, and it's not just relaxing, but it helps your lungs and opens up space to breathe. Which essential oils would I suggest here? I would say thyme and marjoram. It sounds like a little kitchen pharmacy here, but thyme is great. And the oil is said to be best for snoring relief, as it supports the respiratory wellness, immune system health, and of course the nervous system well-being. So keeping these areas healthy can significantly improve your sleep as well as decrease snoring. Marjoram, the brother or the sister of thyme, comes in here as well because it helps to clear the sinuses, opens up the airway passages, and therefore you can breathe much clearer during the night. It works very well. So thyme and marjoram together. The third essential oil which comes to mind is pine. It's wonderful. It's another great oil which helps us to keep the airways passages clear, promotes breathing, and therefore can reduce snoring. Again, it's also an anti-inflammatory agent, and it reduces both the respiratory condition that may interfere with a good night's sleep, and there can be maybe a sinus congestion or a cough. We talked about that when we have the central sleep apnea, that this is a nervous system condition as well. So you want to bring in something which soothes the nervous system, and lavender is very, very beautiful here. It's, as I said, it doesn't help you stop snoring, but it just targets your general nervous system, specifically for the ones who are lacking in their lives, a good night's sleep, because they wake up or they startle and they just don't feel refreshed in the morning. So lavender is a good one to use. Other sites, they suggest eucalyptus, and I think eucalyptus is wonderful, particularly if you have a cold, and of course it helps then to breathe more clearly. But I want to just back off with the eucalyptus essential oil here, because in a minute I want to share with you some very beneficial homeopathic remedies. And homeopathic remedies are very sensitive to strong smelling agents like peppermint, camphor and eucalyptus, and these as I said, strong aromatic fragrances can actually antidote the efficiency of the homeopathic remedy. So I want to back off with eucalyptus at this time. Now, how to use the essential oils? To fill your whole room with your chosen essential oils, put a few drops into an electric diffuser, which then they'll dispense the herbal scent throughout the space, for many hours during the night, and it really would help. Another trick would be you get a towel, you put it in warm or hot water, drop a few drops of the essential oil, the chosen ones which you like, and then squeeze out the towel and just put it or place it on your face, right? And breathe in the essential oils. That would help as well and would help you to relax. Alternatively, you could also put a few drops on the chest before you go to bed, but be careful because some essential oils, if you're sensitive, maybe cause a skin reaction, so you want to be careful with that. Also, like Hong Thai, which is a traditional Thai herbal inhalant, you can get that even on Amazon. It's a green yellow box, and you just open it and just breathe in this beautiful herbs. That helps as well. Adjust your sleeping position. I think that's very important. Elevate your head, bring in more pillows, and you maybe temporarily use a snore guard device, but only temporarily. So usually patients, as I said, use a CPAP, which means continuous positive airway pressure, and it's a common treatment for particular obstructive sleep apnea. And it's a machine that uses this hose or mask or nose piece to deliver constant and steady air pressure. Now, there are problems with it because people often either they experience a leaky mask or they definitely have a dry throat, in the morning when they wake up, even a sore throat, feel a stuffy nose because it's not natural, right? It's like an artificial way how to keep your airways open. But of course, it is necessary if you don't have any other means. Again, if you want to look at losing weight and you feel quite obese and you feel like, Jesus, this is not going to help me, why don't you contact Medica Nova Wellness Coaching Program? I guide you through that, and I'm sure we will find some solutions here which work for you. But to finish this video, of course, I want to share with you some over-the-counter, easy accessible homeopathic remedies. Now, the idea is here, as I mentioned in many videos before, that while I give you now a sort of selection of homeopathic remedies, you want to match the remedy with your specific individual symptoms. You want to find a match, right? What is alike here? And then you see the effectiveness and the magic of homeopathy. Again, we have thousands of remedies to offer, but in this video I want to keep it simple for anybody out there who has access to a health food store where these remedies are offered over the counter. And so I want to just give you simple ideas. The first remedy to start with, often is indicated, is called sulphur. Sulphur 30. Now 30 is the number, is the potency. And in the health food store you will find the number 6 or 30. That's usually what's over the counter offered. And in this case I would say sulphur 30. It's very specific when people experience congestion during the night, especially nasal congestion. They sweat a lot, they feel they have a congested head even, they have a wheezy cough, both which are suffered in sleep apnea. And the keynote here, about an hour after falling asleep, often the sulphur person starts up, right, and screams. It's a great remedy for that. Again, this startling feeling. Personality-wise, sulphur feels quite hot, so they stick out the feet, under the duvet in the bed, and just throw away the covers. They feel quite hot in the night. So think about that. Sulphur would be a good remedy to start with. What's the dosage plan? Well, if there are no other conditions, major conditions to see, of course, always contact your healthcare practitioner. Don't take everything for face value what I say, but I just want to share with you what I share with my patients. But I would say 1 tablet daily for about 10 days, and then have a week break, and then start again for 10 days and see if that really helps. Now, sulfur also is a good remedy indicated if you have skin affinities like eczema or psoriasis. So you maybe catch 2 flies in one here, it could be good. But if you're in doubt, please contact your healthcare practitioner. Contact me at health@medicanova.net. The next remedy in line would be Arsenicum album 30. Again, it's a nice remedy for individuals who have breathing difficulties at night, especially when they have a tendency to be more on the worry side. They feel very anxious, anxious to go to bed because they maybe have another attack. They're very particular, and also on a physical side, maybe there's a lot of asthma going on, congestion going on. I would say Arsenicum album is very indicated for more tense, agitated response to the illness. Then we talked about that chronic cough could maybe cause the sleep apnea. Ammonium, carbonicum 30 is a nice remedy here, particularly if you have much oppression, right, in breathing with the cough. And people wake up often at 3 a.m. with dyspnea, which means they can't breathe, and even palpitations. Another remedy where croup or cough is indicated with sleep apnea would be Spongia 30. Again, here the people suffer from respiratory symptoms that worsens when they lie down. It relieves the tightness in the chest, and it is prescribed for individuals who are naturally fearful, suffer from anxiety, maybe heart palpitations are involved as well. Very similar to ammonium carbonicum. In this case, of course, you need a practitioner. Another remedy, cadmium sulphur 30, comes to mind when the person stops breathing on going to sleep, right from the very beginning, right? Wakes up suffocating or fears to go to sleep again. It's a good remedy. I mentioned heart problems could be associated with it. We have a remedy called digitalis purpurea, but we leave that to the healthcare practitioner. Women who have hormonal issues, hot flushes during the night, feel a little bit fearful, anxious, could be a good remedy. Definitely when you have a fear of suffocation, the remedy would be Lachesis 30. It's a very nice remedy here as well. But I would start with sulphur. We don't have many remedies for sleep apnea because it's really is a unique symptom which affects the totality of the person, right? So what causes, for example, in central sleep apnea, the nervous system to overreact or underreact? What's going on here? So you really have to look at the story of the person and how to help them to boost their nervous system. So sleep apnea can be managed. And I'm not saying that natural solutions are the final cure here, but with all the given information, you may achieve to get off your breathing mask or just, open up more space within yourself so you can enjoy, sleeping during the night. As always, if you need more guidance, please contact me at medicanova.net or health@medicanova.net. Till next time, much love and have a good night's sleep.